The program is called EPIC. It stands for Expanding Paramedicine in the Community, and it's designed to keep people with chronic diseases out of hospital emergency wards. The EPIC program in Grey County has just been extended for the second time. Mike Muir is the county's Director of Paramedic Services. We've reached him at his Owen Sound office. Good morning.
Good morning, Wei. Thank you for having me.
Thank you very much for joining us. Why was EPIC created?
Well, I don't think it's any surprise to us that the aging population is going to put a great burden on healthcare resources over the next few coming years. And Paramedic Services, we deal with that group in on a regular basis in our 911 system. So the idea is to try to reduce the number of times that we're going to be seeing those patients by acting a little bit more proactively while they're in their homes, visiting them and trying to help them manage their disease processes in a very positive way.
Mm-hmm. So, give me a few examples.
Well, the EPIC program is specifically looking at patients with chronic obstructive pulmonary disease, congestive heart failure, and diabetes mellitus. So, and we understand that, and we recognize that these chronic diseases are a big user group of the healthcare resources. So, these are the patients that EPIC is specifically targeting.
Okay, so then the paramedics actually make these house calls then to look after them.
So in partnership with the Owen Sound Family Health Team, primary care practitioners, and our paramedics have been specifically trained in chronic disease management. They have an expanded scope of practice, and what they do is they enter the patient's home, and after they've been selected for the trial, and they do a health assessment on them. They help them with their medications. They work with them very closely. And in the event that the patient's condition starts to deteriorate, or we call it an exacerbation, the paramedics can actually go in and, working directly with the primary care practitioner, they can enact a series of clinical care pathways that they could put in place and treat the patient right in their home.
Anecdotally, what have you heard from the patients, in terms of the difference this has made?
The patients have responded phenomenally to this. We really could never have expected the results that we've had from the patient group themselves. They have the testimonials that we have received, the number of letters that they have written every time the program is in a position to be shut down as a result of the uncertainties around the funding. They've written a number of great letters, and then they've just they developed fabulous relationships with the community paramedics as well.
How successful has this program been in terms of keeping the patients from emergency wards?
Well, unfortunately, right at this time, the study results are just being analyzed right now by Rescue at St. Mike's Hospital. So they were the principal investigators in the trial. So we don't have that information available to us yet, and we anticipate that it will be released probably around the middle of summer this year.
Presumably, though, I don't know if you've noticed this, but would the costs be offset? Do you know what I mean? The cost of the program offset by the savings that would be made in a hospital?
Well, that's one of the questions that we're going to answer and attempt to answer here is by keeping somebody with these chronic diseases out of the hospital, it's going to save a significant amount of money. And so we're hoping that will be one of the analysis that is completed, is the cost-benefit of this program.
Years ago, we talked to the chief paramedic in Renfrew County because they started a program very similar to this where they would pay home visits to some elderly residents in the community because they had a large number of 911 calls. And these home visits enabled them to actually dramatically reduce the calls to 911 because the paramedics ended up having a real relationship, with these people. So even if it wasn't a medical issue, they were looked after better. Are you finding this as well?
I think that's one of the key links to this program is the fact that we are in the community. We're in patients' homes. We can see how they live. We can see if there's any issues around their ability to take care of themselves, or if they have the appropriate supports from either family or the other services that are available. And in the event that those are not available to them or they just don't have them, we can put them in place and we can really help them in the community. A lot of times when we do a 911 call, we pick the person up and take them to the hospital, and it's a very clean, sanitized patient that arrives at the emergency department. However, unfortunately for the hospital system, they don't actually see what the environment that the patient comes from.
Mm-hmm. Must be rewarding for the paramedics who are part of this program, too.
Yeah, our paramedics are really having a wonderful time with this. And if you think about our 911 system, we're about a 40-minute encounter with a patient where we typically don't know what happens at the end of the call by the time we've left the hospital. But in this environment, our paramedics are developing relationships with the patients, and it's really quite a step forward for them because we've never really had this opportunity before.
Yeah, absolutely. And because they get to know those patients, they can see, too, when there's differences, in their conditions. Hey, Mike, thank you so much for speaking with us this morning.
Oh, my pleasure. Thank you.
Yeah, I appreciate it. Bye-bye.
Bye.
Mike Muir is Director of Paramedic Services for Grey County. We reached him this morning at his office in Owen Sound.
This is a CBC podcast.